what's up? It's me, Haley Jones, and we are the Big Orange Business Podcast, and we are here today with Dr. Wesley Mullins, who is a dentist, and we're going to talk all things dentistry, which, by the way, we've already been talking before this, and I wish we were recording because it's so good. But we're going to start with rapid fire. So,
okay.
Are you ready?
I'm ready.
What's the number one worst thing people could do for their teeth?
That's changed over the years, you know. I think the number one thing that's probably worse you can do for your teeth is not go to a dentist. It's easy.
How do you choose a dentist?
Choosing a dentist. Okay, so I've always said this, Haley, is that if someone leaves our practice, they always ask us, you know, who do I go to? I'm moving to whatever town or city. And I always say this, look, you know, we could come up with recommendations based on, you know, whatever. But have you ever interviewed a dentist before you became a patient?
No.
Okay,
never.
So this is what we recommend, is that when you go to another town, call around. Obviously, Google reviews are a great place to start, like we would do before going out to eat. But wouldn't it be great to call up an office and say, hey, new to town, and I just moved to the area, and I'm looking for a new dentist, but before I'm interested possibly in becoming a new patient, but before I do that, I'd love to come by and meet you guys and meet the dentist and take a tour of the dental office. And I always say if they don't want to do that, then okay, you've already 86, you're not going to go see them. But anybody that's proud about their facility, how clean it is, like the personality of the dentist, like that would be like anybody can come and take a tour of our dental office. We're proud of where we're at. So we're proud of the work we do. And I think, Haley, that's the first thing I would say is how do you choose a dentist? You go interview the dentist. It doesn't take much. You know, most women are the ones that are making healthcare decisions today. Yeah. And so it's been that way for a long time. And women care for their family. They want what's best for their children, maybe even their husband, significant other. And I think for a mom to be able to go, or a wife, or even if you're, you know, a guy, you know, go by the dentist and just say, hey, I'm looking for a new dentist. Yeah. And I'd love to meet the dentist. And obviously call first, because again, if they don't do that, right, you don't know. But we have done that for years. When people walk in just off the street, one of the things that we like to do is just say, hey, I know you want to become a patient. Let me just show you around the office. Maybe we'll run into Dr. Mullins or Dr. Anthony.
Oh, love that.
You know, and like we'll step away, shake their hand, greet them with a smile, shoot the breeze about we're a normal guy.
Right.
You know, we're normal people. Too. Maybe meet some of the team members and just make people feel welcome. If you get that vibe, most likely that's going to be something that's going to be met with really good care.
Yeah, I love that. So interview the dentist. Okay, what are 3 markers of like, do you say good oral health or good oral hygiene? Like, what are 3 things that somebody could tell, like, oh, I have good oral health?
Yes. If a dentist was to look at a person, or like
if you're just, you know, I think my gums are like receding or something. Like, you know, what are things that people would be obvious things of like you have a problem?
Yeah,
you know what I mean. Versus like what are healthy teeth? I guess.
Yeah, preventative care, right? If you are seeing a dentist, you know, every 6 months is the typical thing, twice a year. But if you're to like just like be an average consumer and like, you know what, this is a sign that something's not right. Yeah. Okay. I would say, hey, bad breath. All the time, chronic. Wake up with bad breath. That's something that's like a good indicator that something's not right. Something's off. Second thing I would say is like, you know, constant sensitivity. Sensitivity that doesn't go away with some of the over-counter remedies for sensitivity. Like, you know, there's products that say, hey, use this for 2 weeks, and if it doesn't get better after 2 weeks, then seek the care of a healthcare professional. Yeah. You know, so, you know, a lot of people are using these products indefinitely, and I'm like, something might not be right there. And so like sensitivity that's lingering that doesn't go away just on a day-to-day basis, that would be a good indicator of like, hey, there's something not right here. So bad breath, sensitivity that's not going away. And then also I would say changes in appearance. If you're starting to see your teeth get shorter, thinner on the edges, chipping, looking at, there's many people that take photos today, selfies.
What do you mean?
Yeah. And, you know, if you're starting to see changes that are in your teeth, that really, that's not the way it used to look like, then probably if it's not the way it used to look, then there's something not right. There could be something wrong. There could be changes in the bite. There could be changes in oral habits. I mean, whether it's, you know, function that's happening during the day, like most people, you know, they don't clench at night. They clench during the day. You know, you're going down the hallway, you're clenching your teeth. That can cause changes in your bite, things like that. Sudden changes is another thing. You know, if I put one more cat thing on this, like a change that happens suddenly. And that could be a fractured tooth. That could be acute pain, you know, pain that's not going away. And then, you know, too, I think the final metric would be like, hey, you just haven't been in a while, you know? And so some people avoid the dentist.
I do avoid the dentist. Well, I will say this because this is not about me. My grandfather, love my grandfather. Yeah. He was a hardcore dentist. Like, we were afraid of him. So then by proxy, I'm afraid of the dentist. Okay. And I've had some really negative experiences since then. Okay. So I'm always like, oh my God. Ugh. Okay, last rapid fire. Okay. I'm walking through Target, Kroger, wherever. I know where she's going. How do I know which toothpaste is legitimate and which is not? Yeah, just as much as you can say. Yeah, you know what I'm saying?
It's hard. I would say it's impossible, honestly, because I go there and it's so confusing. But consumers and what they see is most likely what's at the eye level. Yeah, is really what's paid to be there. Yeah. So honestly, one of the top toothpastes that you can utilize is the bottom of the shelf. I mean, so, you know, it's very difficult for consumers. In fact, that's one of the things over the years, my wife's a dental hygienist and still practices 3 days a month, you know, and so likes to stay in it, likes to stay up on it. But we've always liked going into the aisle and seeing really what people are being, you know, sold. And it's difficult because most of the time the things that I would recommend and she would recommend are really off in the far corners or the bottom of the shelf, maybe even up high where it can't be seen. Yeah. It's a very difficult thing. Yeah. Yeah. Does that answer your question?
Yeah. Well, it just tells me my confusion is spot on.
Oh, it's because I'm confused.
Well, because it was like recommended by la, and you're like, is that even legit? I don't know.
And there's so many seals of approval, accepted, approved, all that kind of stuff, and even those things too. I mean, with clinical research and continued research into products and things, and as our culture changes, whether it's food or habits or even just the trends of disease. We see it's necessary to have patient-specific recommendations. So I think to offer a blanketed approach of like this product is good for everyone is very difficult now. Used to not be the case because there's like only, you know, there was only like a couple products. Now, even in my career, 20-some years, there's just umpteen million. What do you buy? You know,
it's like buying light bulbs.
That's right.
I'm like, how did this get so?
Right. How do you go on Amazon now and buy toothpaste?
Yeah, I don't know.
You type in toothpaste. What's good?
Yeah. Is this even toothpaste? Right. I don't know. Yeah. Okay. So tell us about your practice. What are hallmarks of your practice? What should people know?
Yeah, I'd say the first thing we've always strived for comfort. Comfort is our chief concern. Whether it's and it's how people are received. We want people to feel received and understood in the reception. Most people come in two ways to our practice, and we receive them either as, hey, I've been going to the dentist for years, you know, I need a good checkup, and that's one thing. They know what they want. You know, they don't really have anything that's like a disability. Right. You know, there's nothing that's really affect them, Haley, on a daily basis. Then there's a patient that's received this way. They call and they're like, you know what, I've got a real problem, and this is bothering me. And they're, you know, talking about a particular area in their mouth, or they're talking about some disability, something that is impacting their daily lives. So each of those people come how they want to come.
Yeah.
Right? So people get a choice at our practice. And I think people like choices. We are offered choices every day, and and we offer them in this way: is that one, I understand that you want a cleaning and you've had not really having any problems. That's great. There's a couple ways you can come to our practice, and one of the ways is we like to offer you a visit with one of our dental hygienists, and they visit the dental hygienist the very first visit. There are things that we would create awareness for,
right?
Concerns, and that might not be concerning to them, and it might not be something that they want to address right now because you know what, they came for a cleaning,
right?
So we receive people be understanding that they want to be received with a choice, so we offer them a choice, and even in the chair, hey, like, is this something that concerns you? Nope. Okay. No problem.
Cool.
Right? Then the people that come that have a disability on a daily basis, we don't even have to, work really hard. We're here because we're hurting.
Yeah.
We have whatever X problem, and I'm like, and most of the time I'm like, we're sitting in this room that we're talking in right now, and we meet people in this room. This is where I meet people that have problems.
Yeah.
Because I don't really want to go back there.
Yeah.
Yet.
It's scary.
It is.
Is
scary.
that why? Kind
of 100%.
Mentality, like it's scary.
Since the day of my practice, I was down the road here, had a space for many years, and I would always bring new patients back to my personal office. I kept it like a little consultation room, kept it clean and neat, and because most offices, business offices.
Well, there's also like drill sounds.
Yeah,
here.
I mean, you don't really want to go back.
There's a lot going on.
Well, and what you find is when you meet people like that.
Yeah.
When I'm sitting across somebody, like we're sitting close together, and we sit, mimicking, like right now we're social mimicking, right? There's some things going on here where we're trying to have a conversation.
Right.
It's amazing. The barriers drop, the stories come out about, and I'm just listening. And they're just sharing all their dental whatever.
Right.
Past experiences, all the problems they've had. And what we get from that is we get very important information. How do we take care of this person?
Yeah.
And we start thinking in our brain of what? This is exactly like that person that I saw last week or 10 years ago or 5 years ago. And then really we do all the diagnostics that we would do for anybody that has those conditions.
Yeah.
And I don't have to throw that up in their face.
Right.
All I just say is they're wanting those solutions. They don't need a tour of their mouth. They don't need to be explained anything. They don't want to see any of that because they're dealing with it daily. I'm not dealing with it daily. Dentists have a tendency to want to create value for their knowledge. These type of people don't need knowledge.
Yeah.
They already know they need help.
Right.
And
it hurts.
It hurts.
Yeah.
Fix me. I don't care what you have to do. Tell me what it's going to cost. Tell me whether it's time, money, whatever it is. It's going to cost somebody something.
Right.
So we want to definitely end that appointment with people that come with these disabilities with, hey, what is this going to cost me? And some people have different, costs.
Right.
Sometimes it's money, sometimes it's time, sometimes it's like, hey, I got a wedding coming up in next month. I need this fixed ASAP. So we want to meet people and understanding them. If it's just like somebody, again, that wants to come in, just have their teeth clean, meet them with that. Then get them in the chair. Hey, we're seeing some concerns here. This concerns me. And they're like, yeah, it actually concerns me too. Yeah. Can we fix that? See, it takes a little bit of education like that because it's not hurting daily. Right. Because honestly, most dentistry that's a problem on the front end doesn't really hurt. Yeah. It's when it gets really bad.
Right.
That's when it hurts.
And that's when it hurts.
Yeah.
Does
that help you?
Yeah, no, totally. So when it comes to how people pay, we don't have to get into the weeds of this, but do you recommend dental insurance? Do you what's the recommendation? How can people pay? Because I do feel like that's a barrier for people to come to the dentist or not. Yeah. Do you know what I mean? Yeah. So what are your thoughts and recommendations on that?
Yeah. So dental insurance is a very interesting thing, and over the years dealing with it, it's frustrating for one, the patient, and number two, it's frustrating for the dentist. And I feel like that we're always caught between a rock and a hard place. Right. We're doing the negotiation for them to help them get care. And we're caught in this this is what they're saying they're going to cover. This is what one person's saying. And it's a very hard thing to really give solid answers on. I feel bad for people that have dental insurance and expect it to be like medical insurance.
Yeah.
It's not at all like that. And it's not changed in a long time, since the early 70s, really.
Yeah.
And the amount of benefits, the cost of dentistry has went up, the cost of dental insurance has went up, but the benefits really haven't gotten any better. And there's this whole idea of like, it should pay for what? And it's different across the board. It's not consistent. It is a very difficult thing for people and dentists to deal with. And so, I'm not a fan of dental insurance. It's something that's gotten a lot worse for dentists and patients, and so we don't recommend it unless you have like a big family.
Yeah.
Big families, I feel like it benefits them greatly.
Yeah.
I think there are other ways, and financial planners and even insurance agents have talked to me about other ways to care for them out. Health savings accounts has been a godsend for a lot of people, and honestly, to me, I'd rather take that money monthly that you're committing to dental insurance and start yourself a health savings account.
Right. Well, interestingly, so I used to be a teacher, and like I always just got dental insurance because it seemed like so cheap, but I had never asked like how much does a cleaning cost.
Right.
And I was like, I should just pay for the cleaning.
Yeah.
Like that would make more sense.
And you get to choose where you go. And in today's market, it's all over the board who accepts what. You can get to an office out of network versus in network. There's a big difference. I understand there's different budgets. Sometimes insurance makes sense. Like I said, for larger families, we feel like that's where insurance can really be helpful. Yeah. For individuals and maybe couples and a few, maybe one or two kids, we offer other plans, even internal plans to help people pay for it on a monthly basis.
Yeah. And you see the whole family, right?
Oh,
okay.
Yeah, I have for years.
Yeah.
I'm really seeing younger kids than I've ever seen from birth all the way up.
From birth?
Oh, yeah. We have an emphasis on early childhood development here.
Yeah.
Pediatricians are trying to look at like symptom-based problems.
Yeah.
They do monitor some growth and development, but where we come in is we monitor growth and development from the head and neck.
Okay.
And so our particular team here has specialized training from birth and the changes that we see in a child and what mom and dad can do to help that child grow healthy. And so a healthy face is what we're trying to help grow. And as an expert in growth and development, our team really comes alongside of moms and dads, and we help them recognize those early signs that may not be symptom-based signs that they don't see, that they're so small that even they fall under the radar of a pediatrician, and we pick up on these things. And so kids don't grow into a bad face. Yeah. We want kids to grow into a healthy
And when
face.
you say bad face, you're not saying ugly. You're saying like it's unhealthy. Like,
right.
So for example, what would be...
Well, one of the things that we see with growth and development is the lack of growth of the mid-face. And that stems from...
What is that?
So the mid-face is between underneath my eyes down to the top, the bottom of the top teeth. Does that make sense?
Yeah.
And so that mid-face really starts with being the driver of the lower jaw. And if a child or even an adult breathes through their mouth, or we have an open mouth posture, or a child maybe didn't have the opportunity to nurse, or mom didn't want to nurse, or they were fed more of a soft food diet for those first 3 to 5 years and weren't given foods that help to strengthen the face, then what happens is that open mouth breathing posture, maybe poor diet, leads to the upper mid-face, this mid-face being like not underdeveloped. Okay?
Really?
So that underdeveloped mid-face, then one creates a smaller nasal space, right? Everything sets back in the face, so basically this sets back, and then as the lower jaw tries to grow forward, it actually gets held back. So we end up with this elongated face and this continued open mouth posture, and you end up, cramming all of the anatomy into a smaller face. And so we see a whole host of issues, and it all really stems from that birth to 6. So our job is to help identify, and this is just a high level.
Yeah.
This is
I'm
just
like, my mind is blown
so,
right now. Yeah.
Where we see it, is that we see the effects of this later on in adolescence.
Okay.
And where we really have seen is that there was a large pendulum swing away from early childhood development, like identification.
Yeah.
Because it just wasn't being taught in schools
Yeah.
anymore. It's something that we've known about for eons in dentistry and ear, nose, and throat doctors and all these developmental experts, archaeologists and anthropologists know about this growth and development, and they've talked about it for years. But it kind of got left by the wayside in the 80s and 90s, and even in today's, it's really hard to bring this back. And so there's a big push from the ADA, the American Dental Association, American Pediatric Association, University of Stanford, and multiple, Tufts is a great place. There's multiple people that, that are really behind the movement to try to re-educate our healthcare providers to early intervene with some of these things. And it can and we can have an impact on a child's life. And there's been links to major health problems such as sleep apnea. We see children in their cognition is decreased. Even links to ADHD and some of those things. I think that's kind of a hot button for people. And then just sleep in general. Kids that aren't sleeping great and kids that are really not feeling well, but again, a pediatrician, and maybe doesn't get to them.
Right.
Maybe it just doesn't get to them because kids are great compensators. Humans are amazing compensators. We'll compensate so much as a young individual. You ever heard kids respond better than we adults do?
100%,
So I mean, we fall down and we're like aching for days. Kids fall down and they're like, man, they just responded like really easy.
Right.
So kids are great compensators, and so they mask a lot of these underlying issues. And I think it does take a team. And I've been blessed to be able to be around people that have helped me create a team of people here in our community that are forward thinking. And so it's been wonderful to be paired up with Children's Hospital and some of the ENTs there, some growth and development experts there, and then also too other dentists in the community here, orthodontists that are forward thinking, and then also adult ENTs that I have here in our community that are forward thinking and really starting to question even what they're doing in their clinic as far as treatment. And then too, I employ therapists here. I have a myofunctional therapist on my team, and then there's other dentists that I refer to in our community for correction of some habits and things like that. But see children all the way up until death, and enjoy treating both ends of the spectrum. I really do. I see the debilitation on one end at like 60, 70, 80, where we didn't catch things like we should have, or maybe the patient didn't have an opportunity to even get to the dentist, and now here we are. And so, and then on the beginning of it, I like to prevent so many things that we can, if we can just get a hold of these kids and maybe help them change their life and grow into a healthy face versus growing and compensating into something that's not quite healthy.
Yeah. When it comes to like an older population, or when we're looking at someone's progression of health, how is oral hygiene related to like your overall health?
Oh, it's amazing. I remember the first report on oral health came out in the year 2000. I was a sophomore in dental school. And basically the Surgeon General reported that oral health is linked to overall health in several
Say it again for the people in the back.
Oral health is linked to overall health. And really what was going on again is like this gap in education and communication. And so whenever we have communication and it doesn't connect, you start filling in the blanks, and there becomes a separation in this siloed like healthcare system, which goes on today even. I mean, that's one of the frustrating things about healthcare today is we're not talking. So what happened is the Surgeon General came out with this, and this was the first report on oral health and how it impacts overall health in the year 2000. One of the things is gum disease. Gum disease is linked to overall health in what ways? Well, it increases our risk of heart disease, increases patients that have COPD, chronic obstructive pulmonary diseases. It's going to increase them having those attacks that are not very fun. When the COPD has an attack, it can be exacerbated by periodontal disease. And then I think about too, one of the biggest things in America right now is we have so many diabetics and pre-diabetics, is that oral health and particular periodontal disease is linked to diabetes, and that A1C that we're always trying to get below 7, you probably heard that out there, is that your oral hygiene can affect your diabetes. We've seen patients over the years that have been treated for gum disease that actually they've decreased their A1C and sometimes been able to come off their medication or decrease their medication. And so what we found is that as we've really dove into this since the year 2000 and before, is that these links are crucial. Imagine this, is that there's an increase in preterm low birth weight babies with women that have poor oral hygiene and periodontal disease. That's been
really?
And that's been around since the year 2000, and I still lament over the fact. Now, we do have people in our community now, I hear of women in OBGYN places, because this has been researched and found to be legitimate, is that OBGYNs are looking in the mouth and making sure women are actually getting oral checks. And so I think that's incredible. I also think too, like chronic inflammatory diseases such as rheumatoid arthritis or just arthritis in general, those things can be exacerbated by periodontal disease, which is a chronic inflammatory disease. So we do see a connection between those things. And so C-reactive proteins is a fancy term for like stuff we test for in medicine, is like one of these things that we can look for to see how much inflammation is going on in your body. And part of that inflammation can be uptick because you haven't had a good, oral check or haven't had diseases that are under control. The number one disease of mankind is caries, dental caries or cavities, right? I'm thinking 20 years. In 20 years, I would have thought that we would see the kibosh put on like cavities. But unfortunately in America, we have such a, and I'm guilty as charged, we live in the South here. You like your sugar, you like your energy drinks. Everybody wants to go to Starbucks, and most people aren't getting sugar-free. Most people are getting the Cokes and the sodas and all that kind of stuff. And with this continued like non-healthy atmosphere that we put ourselves in, at least in the South and our culture here, decay is at an all-time high. And as we get older, people are keeping their teeth. The average person over 40 is missing 12 teeth. Now that seems like a lot. And every time I tell somebody that, I try to encourage them that in the chair that's over 40, I'm 47, okay? And so if I see somebody over 40 and they're not missing 12 teeth, then I tell them that. And they're like, really? Like, I'm missing a few. And I'm like, yeah, you should feel pretty good about yourself because you've done pretty good. But as we age, right, we're getting into these people that are living. I'm seeing more people over the age of 70 than you could possibly imagine now, and they're keeping their teeth. But what we're seeing is like management of that geriatric time, that last 10 years of life, right? That 70 to 80, that 75 to 85, right? Or maybe it's 65 to 75, where we start to see the system start to go down, but they're still able to function, live in society. Trying to keep up with the oral health care conditions is really difficult. One, maybe mobility's down, maybe they can't brush as well, but number two is like they continue this eating lifestyle of sugar and all that because they've made it this far.
Right.
So what the heck,
must be fine, right?
But then they don't have the saliva, right? You hear this chronic thing called dry mouth is like really bad. They're on a few medicines. Most people in Tennessee are on 5 meds. And so, it's crazy. So a couple of those meds cause dry mouth, not to mention, we live in East Tennessee and it's just like the allergy capital of the world, so you're taking antihistamines, so you're already drying yourself out. So imagine, hey, I've got chronic dry mouth, I don't have God's natural protector for teeth, saliva, and then they're drinking Cokes or iced tea, sweet tea, right? You know who you are, and so they end up with they're getting more decay now than they ever have. And they're like, man, I was just at the dentist 6 months ago and you're telling me I have all these cavities. And I think it's really disheartening sometimes too. I walk into situations where I can't do anything.
Yeah.
And then
it's like too far gone.
It's too far gone because, mom couldn't get out of the house because she's been sick and now she's going to lose all her teeth. That's tough.
This is a very broad question. So you can be like, there is no answer for this, obviously. But it is, like if someone's parent, for example, has lost all their teeth, now they have dentures. I was gonna say gummies.
Maybe they're just gummies.
Dentures. Yeah, exactly. Mm-hmm. Is that genetic, or is this like? I guess it's all preventable. Like anything genetic, in theory, is preventable.
Well, I think
right?
the thing about like genetics, and I'm using another term, epigenetics.
There we
right?
go. Yes.
Have you heard that before?
Yes.
Right.
Yeah.
Which is what turns the genes on, or the atmosphere that promotes the genetic. Honestly, if we don't even think about genetics and we just do the right thing, you're going to win.
Like in your environment,
basically. Yeah, basically, if you just do the right thing, regardless of what mom or dad had, you're going to win. Like,
so go to the dentist.
Right. Exactly. That's all I'm saying.
That's all I'm saying.
Right. Don't blame mom and dad for your oral health. And I'm not saying that there's not people out there that don't get past a bad set of cards here.
Yeah.
There are people like that.
Right.
But that's far and few between. Over the years of practicing, I really have just put the kibosh on even having that conversation.
Yeah.
Like, no, let's focus on what you can do right now.
Right.
Don't put it on mom and dad.
Right.
Right? Let's own the issues and make the effort.
Right.
And we'll win.
Right.
Most of the time we win.
So we're like out of time. I have 11 million more questions for you. Is there anything I haven't like asked you that you're like, I gotta talk about this, we gotta mention this? I mean, obviously, we'll end with where people can find you, all those things. But is there a question that I've missed or something that you're like, we cannot stop this without me saying, ugh?
Yeah, like one closing statement.
Wrap your how many year career?
2003. So 22 years.
Wrap that up in just one sentence.
I mean, who we're talking to. I guess who we're talking to here. Just kind of off camera now.
Yeah, no. Well, I mean, we're talking to basically, all my questions are, selfish, but also like, what's going to be helpful to people, like if they don't go to the dentist or whatever. So, if there's things like people should know specifically about your practice or about dentistry in general that you're like, hey, we didn't touch on this.
Yeah. Well, I'll tell you what, we're living in the most exciting time in dentistry. I'm not joking. We can do so much now.
Yeah.
I'm able to, in our practice, again, I've been blessed to have been around some amazing people over my career that have influenced me to be able to bring things from the world's best to right here in East Tennessee. And I just think about what we're able to do for people. It does cost a lot sometimes to get back what you've lost. But also, even that, we're able to do things so much more comfortably. I think that with modern techniques and modern thinking and modern treatment planning, looking at people not just from a one-tooth mindset. And that's where we're at in our practice, is that we can do that. Sure, we can do that. And there's a place for emergency dentistry, and we take care of our people when it comes to that. But when it comes to like the mindset of our practice is to meet people where they're understood and use amazing technology to be able to provide predictable, consistent outcomes. Is it going to be easy? Maybe not. But we're going to do our best to provide the best comfort, the best environment, put you around the best people possible. And two, I'm going to never stop learning, right? And I will commit myself, and my team commits ourselves to bringing the best to East Tennessee. We're never going to stop doing that. And that's one of the reasons why I have a hard time letting go of this, because I don't want to be told what I can't give that person that's sitting right here where we're at. Because if I'm told what I have to do, or I'm stifled in some way, I just don't think I can sleep at night. Honestly, knowing that. And I'm just not ready to quit.
Yeah. You're like about the patient, about the people.
Yeah, people deserve to know what they can have. It doesn't mean they'll always choose the best, but shouldn't you know what the best is?
Yeah.
And we offer, and still yet offering the way people maybe can, or maybe they can afford something that's less expensive or something. We'd love to be able to do that as well.
Right.
But just I really want to help people that get to their dream, whatever that is. If their dream is to be able to go out and eat with friends and not have to think about their teeth, that's our goal, right? People don't want to think about it.
Right.
I don't want dentistry to be a distraction to your daily life. And so, if you go back and look at our core values on the wall, it's one of those things.
That's awesome.
Yeah.
And I just want to say, as an encouragement, like, I'm the last person that should be saying this, but I have met a lot of dentists. I have been around a dentist or two. And I do want to say that, if you're nervous about going to the dentist, or you have you can say those things and tell the dentist, tell the hygienist, tell those things. Like, don't let that be a reason not to, because it obviously is important. But I just think it's like not all dentists are created equal. So, give the good ones a chance is what I'm saying. So, where should people find you if they want to connect, if they want to come to your office? Where should they go?
Yeah, so we're located in Powell, Tennessee. That's just outside of Knoxville and in the northern part of town. That's a convenient location.
Super convenient.
Yeah.
Yes.
We can be reached at myfamilydentistry.com. That's our website. You can find information about how to schedule an appointment there, or 865-94-SMILE.
Love it.
Yeah.
Awesome. Thank you so much,
Yeah,
Dr.
thank you
Mullins.
so
This
much.
has been awesome.
Yeah, this has been fun.
See you guys next time.
See you.
Bye.